test, they go ahead and pass the other test as well.
Yeah.
And the biggest mistake I have seen is when the students don't pass AANC and they jump into AANP thinking that the problem was the test, ANCC, right? And that is not true, guys. The problem, it might be, or either the preparation wasn't tight. It's very unlikely. I don't know a lot of people that didn't pass on one and jump on the other and pass it right away. What I ask everyone is to, if you had a setback, take it back and look, did you do all the steps that you're supposed to do? Where could you have improved rather than jumping to another test? Now, the caveat to that is if you truly prepared and like a 2 months preparation, you did everything you need to do, question bank, diagnostic tests, attend the live classes, watch the live reviews, downloaded and printed your PDF, then go ahead and schedule your test for Monday, a Friday, and a Monday, for example, because you will pass both of them. But, you know, by doing a halfway preparation and hoping that you'd pass a one or another, that is not a good tactic, right? Um, but yeah, so
So one thing more I want to ask before I let you get into your class.
sure.
I already had signed up for the pharmacology class. How does that one go? Is that a live session or we work on our own?
No, no, I'm already skinny as a bone because I don't even have time to eat. I can't do two courses that are very intense. I'm telling you, like I've been eating like one meal a day.
No, no, I just
Um,
want to know so I could
yeah.
make
So
provision.
basically, it's self-paced, 1 year, everything you need. There is a PDF in there. There's medication charts. It is really a course that you take it so slow because it will be very deep in knowledge. We are going to talk about receptors like no one does. Let's put that way. Each medication's receptors, why one is more D1, D2, how is it stronger affinitive to a dopamine pathway. So that way you can pick a medication and you have a good sound theory behind it while you're picking one versus the other. But it is not an easy class,
Yeah,
but that's where you are now.
yeah,
You're no longer a student. You added to practice, and you don't want it to be easy because if it was easy, everybody would be doing. That
yeah.
is the truth, right?
Yes,
So
definitely. And one thing more before I go,
yeah,
for those who want to do the AANP, they focus, and I saw a few people in the chat said before, they focus a lot on PEDS, except pre-adolescent, and the screening process and ADHD and autism. They had quite a few questions well on autism and ADHD and the screening. So they kind of like focus a lot on the adolescent population, and they had some on the trans theoretical model and thing. But those you could figure them out. But I mean, if you get the knowledge, like I said, you can work your way around it.
all right. Well, thank you very much for stopping by and giving us the good news. It's always refreshing to know that people are in the right track. So as I am opening my email right now, can I want to share you guys something just open right now. Her name is Nora. Nora, let me see. Hey, Nora. Yeah, you're welcome and thanks for the test. Diagnostic test 1, 2, and 4 were all related to the exam. I highly recommend for everyone, I highly recommend for nobody that's going to be taking the test. Um, I guess I recommend for everybody taking the test, going to take the test, to do those questions. Guys, you know, I cannot stress enough. I cannot stress enough. Uh, if you are not taking your diagnostic test, I could almost tell you that you're leaving out like an extra 20, 30 points. And that could be the difference between passing. I mean, one question could be the difference between passing and not passing. So every time somebody doesn't pass, right? I do a back, I go back, I I investigate their steps, what they did and what they didn't do a little bit closer. And I always find big holes on their preparation. Even though we're emailing, we're telling, you know, telling people what to do, but you really need to get your test date and walk backwards and make a map because everyone is going to be different, right? Some people are set to test in 3 weeks and they say, I'm going to test in 3 weeks. I can do it, right? That's fine. They probably can. It's doable. The content is there. But if you don't have a map of when and how you're going to accomplish things, you might just don't have time, you know? And I can tell you right now, as you prepare for modules 1 through 5, and as you prepare on diagnostic tests, as you sit down for the for those crash course review, as you sit down for the diagnostic tests, make it as real as possible. Make it as real as possible so that way you find out what you don't know early. But if you just take the test and kind of like, yeah, I made a silly mistakes, and you take another one and you fall back in the same thing, I think I can pass. Well, it is a hard test, but it's very, very much doable, right? Today we probably had 10, 15 people passing, so lots of folks passing. Another one here is what's his name is JJ. Oh, it's jerk. Let's say, hey, Dr. Lopez, I got my green check today. As I pass, whoop whoop, praise the Lord, amen. I mean, these are the things that that we get it. Like as I open my email, I get tons of these, right? So right here, uh, you know, JJ, right? So I got my green check today, and the list goes on and on and on. And I like to say a little story of, I think it was last week, maybe like, yeah, it was last week. Roxanne and somebody else that did the prep. Both of them passed, right? So they both achieved the goal. But the one person was like, it was so hard. Oh my God. But everything was there, but it was so hard. I was confused. And, but I passed. Everything was good. Roxanne was like, man, the test was like 1+1. But why would that be if they all got the same content? How can somebody say the test was 1+1 and it was so easy, absolutely easy? Because Roxanne, she truly prepared. I looked at her stuff. She was on it. She accomplished all the goals of the course. She did all the question banks. She did all the diagnostic tests twice. That's a lot of testing, right? It's 3.5 hours each test. But as she walked in the test, she was kind of laughing and finished her test with an hour and a half left over. But, and I don't think you should be one or another, but somewhere in the middle where you do it enough that you are only going to test once. Only going to test once. That should be your absolutely goal. So, keep that on your mind. Test once and once only. But have to do the work. Okay?
Dr. Lopez, one quick thing what I would share is you have to put in the work.
Yep.
I took 2 weeks off of work and I spent like about 15 hours a day for the 2 weeks. That's all the time I spent. And I did all the diagnostic tests and the question bank once. And I did them when I feel that I have the knowledge and this is what I'm taking into the test. Then I did my diagnostic test. Then I have a 86 and a 80
Yeah.
and so you have to put in the hours. I don't think a half an hour here or a 40 minutes there would cut it out.
Yep. No,
I
you're
mean,
absolutely right. I
for some
definitely,
people, it might.
yeah, I definitely recommend that minimum, 1.5 to 2 hours every single day over a good period of time. Um, but anyways, enough with that. What we'll do is we'll have one more person, Nazilan. If you go ahead and get, you have a question, and then we get started. You are muted if you're trying to speak. Nazilan, hi.
Hi, Dr. Lopez. This is Elma.
Hi, Elma. How are you?
I'm great. I'm just stopping by to say thank you. Thanks to you. I got my green checks today.
Whoop, whoop, whoop,
I've
whoop.
been with
That's
you
good.
forever.
It's all good. Hey, I don't mind that. As long as you pass, that's all I care.
I really
So,
very thankful. You give us all the thing that we need, the time, the patience that you have with us. Basically, people can actually say you have the actual exam. You
mm,
just the only thing you cannot do for us is study the material for us, but whatever we need, you give it to us. I mean, literally.
good, good. Y-
Even the third diagnosis test that you send us, just the
Mm,
questions word to word.
mm.
They just we frame the question, but the same questions. There's more than 50
Yeah,
questions. You just have to put
psychiatry
the work to
is,
it.
yeah, psychiatry is, it doesn't change, guys. Adjustment disorder, it's always going to be
Yes.
the same questions. Now they change the flavor. My mother, let's say I'm an adolescent, that would be traumatic to me. My mother got remarried, right? Or my dog died, or I got a herpes. I mean, it's the same things. They don't change. It's pretty easy when you start understanding the patterns of tests. It becomes kind of easy. So, uh, I'm glad to see it worked
Yeah.
out for you.
As a matter of fact, even the example you take with us, sometimes you be taking the example for yourself from what every word. If you actually cannot sit at the test center and hear actually Dr. Lopez talking to you in your head and say, no, 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 yes, 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 you're not there yet. You actually
Yes,
we have to hear you talking to us, on the exam and say, don't do this, but you have to put the time
you have
because
to
you
put the time.
cover all the contents,
Yep.
nothing missing. Everything we need, it just is right there. We don't even have to go to no purple book, no anything. Just try to learn the concept back and forth, that you actually walking to the center no anxiety, you got this because you already spend all the time. Now is the time for you to actually shine because
Yeah.
you know it.
If the goal was for you to go to the purple books, then I would not do the PDFs, right? So people say, "Oh, the PDFs are long." No, they are not. They are not even 10% of the purple book, right? I mean, I digested, and make it more doable. But still,
Mhm.
if you do it, wait for the last minute, you might get in trouble. You might get in trouble. But everything is right here. You can watch the lectures as many times as you want.
You
You can
absolutely right.
you can come to the live classes as many times as you want. I'm not really picky. If you need more help, in my emails, I'm always talking about my emails because I spent at least 10 hours a day on my emails. At least, literally, 10 hours. It's about 50 to 100 emails a day. So, which is okay. It's totally fine.
Yes.
That's what I'm here for, to get you guys to the next level, so that way you can go on. Like today, I was answering somebody's that asked me how to open her business. So I go ahead and provide those resources too, because we're a community, and this is not. I like to think this is not it. When you guys pass, you can always count on me as much as I can. So if you need help, I'm here. So
Thank you so much. I'm really thankful for finding this program. It's just you are truly blessing to me. I'm
thank you.
really thankful. I can't ever thank you enough. I really appreciate all the help, all the support. I'm really thankful. That's what I'm really thankful. May God
Y-
bless you.
you
And guys,
know,
just focus and trust the process.
yeah, it's one thing, right? So you see one, you do one. So what do? You do the same thing for somebody else that maybe need, like somebody may not have enough money to pay preceptors or something. Be kind. It's not going to break the bank, like
Exactly.
I mean, be kind, because we all been there. We all needed someone. At some time in my life, I needed someone to buy me a Coca-Cola, and nobody would, right? So just be kind. We're all human beings, and and they stick to each other.
Yes.
Uh, and it'll all be fine at the end. I
Yeah.
promise. Okay.
Very thankful. Thank you so much, Dr. Lopez.
All right. Thank you so much for stopping
Thank
by.
you. My
So
pleasure.
we are going to get started. So it is 7 p.m. Eastern Standard Time. I came in an hour early thinking I was late. I was super early, an hour and a half. I was like, oh my God, the class is about to start. It's always confusing to be in a different time zone. So what I'll do, just so we can get through everything, yesterday was kind of long. So today it will be a little bit, still going to be a little bit long, but I'm going to mute everyone. And then immediately after the class, we answer questions related to today's content so we can release everybody else. And then I stay behind for another hour and walk you through the content or where things are located, all the same questions that we always get it. But I really ask everyone to put a little bit time in learning your platform. Explore, explore, because once you get the initial where things are located, it becomes second nature. I know it's a little bit complicated and maybe it's not the super easy, but we're always looking to improve and make it better. But spend some time. It's everything you need is there, and I'll show you some golden nuggets at the end of the course today. Okay, so let's get started. Uh, 1 second. Okay. All right. So from now on, if you have a question, oh, I'm so sorry. Uh, one more. Juki, did I butcher her name?
Jinky Jaira.
Jenkins, JJ, hi.
Yes. Hi, I just come by to tell everybody I passed today
Whoop
and
whoop.
I got my green check. I was so nervous. I stayed 3 hours and 30 minutes. So I said I might as well stay until the last minute. So it was not an easy fight, but
Okay.
you know, the modules and the diagnostics exams really helps because there are questions that is word for word over there.
Alrighty. Well, I'm
Yeah.
glad that helped. How long did you study for, by the way?
So I purchased the program second week of September,
Okay.
and then I took off like probably 2 weeks and then roughly 10 weeks or 8 to 10 weeks like
That
that.
is the perfect amount of time. In
Yeah.
my view. I mean, some people may need a little bit more, some people need a little bit less, but the 8 weeks it gives you one solid week per module as long as you are doing the work. And no one ever going to be like, I know everything, right? You know enough to be comfortable. Okay,
Yeah.
you know enough to be comfortable. Now, though, I really want to stress this because some people really think they can just walk through this test. Some people really think they can, and some people can, but it's not the majority of us, right? So it is a hard test, but once you get the secret, once you know how tests are made, it becomes easy. Okay.
Yeah.
Well, thank you, JJ. Appreciate it.
All right.
Super.
Thank you.
Thank you,
Yeah.
Dr. Lopez. Please, I passed.
You too. Okay. Anybody else passed today? I know it's so good though. It's good. You took it the ANCC, Tola? Oh,
ANCC. I'm
all
still
right.
waiting for I'm going to schedule my AANP. Thank you so much for your support and everything. I just want to encourage everyone that this program is awesome. Everything you need to succeed is right here. It's at the tip of your finger. I'm telling you the truth. If you go by the diagnostic, it's the big deal. And it's good for us to understand the process, understand the modules 1 and module 1 to 5. I have a lot of questions. I have a lot of questions from SIWA,
Yeah.
the SIWA calculation, the neurotransmitter.
Yeah.
I can tell you 100% this program is awesome. So everybody, you are in the right place.
All right. So good, good,
Thank
good.
you so
Lots of,
much, Dr. Lopez. I appreciate
yeah.
everything. Your time and dedication is I don't even know how to express it. God bless you for everything.
Pay it forward. We have students that are struggling right now. We had one today, kind of really broke my heart because she was sad. But I gotta talk to her and see what she did and what she didn't do. And sometimes it just happens that way. But if we can do something to prevent that from happening, is what we should do early. So all of you guys that haven't tested, all of you guys that are new, please pay attention to the content and get a schedule early. Please, please, please. It's so important because test once. Don't be on the program. I love to have you here for as long as you need me. But the reality is that the longer you stay and don't complete the race, you go back to the beginning and you keep going. And by the time you realize it, you stay here for a while and never really finish all the way through. So when you start to study, become non-stoppable. Just keep on doing it, keep doing it, keep doing it, and then go test it. Okay. All right. Thank you very much, everyone. Lots of blessings today. Lots of people here really giving their feedback on how everything went. So let's get started. Let me make sure that I do have here on the side so that way, if for whatever reason my mic stops working, I know. Okay. So perfect. Not perfect because it's not showing. Okay, 1 second. Oh, okay. All right. Okay. So yesterday we stopped at DMDD. I don't know. I don't know is what people with DMDD usually say, right? A major depressive disorder. So please take a piece of paper and write it down because I muted everyone so that way we can get a little bit of rhythm going and I don't lose my train of thoughts. I don't use notes. I'm a free flow. When I see my slides, I go in my own world and I pretty much a daydream on the content because I love it. But if you have a question, write it down on the main content and I can always answer that at the end. Okay. So DMDD, main thing to differentiate between delirium, Alzheimer's, uh, and major depressive disorder, right? Dementia, delirium, and major depressive disorder. So people with delirium is fast overnight, over a few hours. They're fine, and now they have a fluctuation in conscience. Dementia is long time, and this is one of the reasons why we use scales in psychiatry, right? To be able to plot um, the slum, the MoCA, the mini cog, or the MMSC, for example, right? And major depressive disorders compared to dementia is fast, right? Few weeks or few months. Now, major depressive disorder, what they say, I don't know. I don't want to try. It's too hard, right? So, several treatments for major depressive disorder. Yesterday we covered SSRIs. Why is SSRIs the number one prescribed medications? Right? Everybody remembers that. We talked about which SSRIs, which one of them is most likely to be the least drug to drug interaction. Hence, Lexapro, right?
Oh,
Um, 1 second, make sure here that everyone's slide is kind of turn it off. All right, Lexapro. We talked about a little bit of Prozac as well, the longer half a life. And we talked about that don't change meds unless if it's been at least 6 weeks, right? SSRIs. Now, sometimes in rare cases or in more difficult cases, we have something called major depressive disorder resistant to treatments. In those rare cases, electroconvulsive treatment could be useful, specifically for those with catatonia, or in this case, major depressive disorder with psychosis, meaning that what is the difference between major depressive disorder with psychosis versus versus schizophrenia, for example, right? So the major depressive with psychosis, they only have psychosis once they are depressed, right? While schizophrenia could be more like the norm in case if they are not being treated correctly, right? So electroconvulsive treatment is not the first choice, right? It's usually the last choice for everything, even for schizophrenia. But when it comes to major depressive disorder, one needs to be really careful uh, recommending electroconvulsive therapy treatment because it is an intrusive procedure, right? So it is only for those that are resistant to depression medication. They have been tried in many classes and they have not achieved a good outcome. Now, let's say you decide to recommend your patient. What are the things that you would think whether a patient would be a good candidate or bad? Well, let's start by saying that for ECT, they need to have anesthesia, right? Because it's going to be a mini seizures like induced. So anesthesia will be given. So therefore, they need to have good heart because you want the patients to come back, right? Um, so they need to have good lungs, right? And preferably no brain injuries or trauma. So heart, lungs, and brain, right? And the ability to, okay, 1 second. So someone is saying there is no sound. Is this true for everybody? Can you put your finger, your, okay. Everyone can hear. So please double check your phone, your audio because everyone can hear. So I mean, it's not from us. Okay. So I just want to make sure because if it was for me myself, or if I was the one, I can try to fix it. Everyone's saying they're good. So all right. So let's get back to this, please. If you need to log off, come back. Sometimes that helps. All right. So good lungs, hearts, and brains, and they need to tolerate anesthesia. Okay. Now this is important. What do you think is the number one complaint after they finish ECT? Right? Short-term memory disturbance. They may not remember what they had for breakfast, right? Which some of us don't even need ECT for that, right? But short-term memory is the number one complaint of a side effects for ECT. Now, there are other complications such as cardiac dysrhythmia or arrhythmias, headaches, very likely, muscle aches, drowsiness, and so forth. But short-term memory complications is very common. So remember, ECT for very severe case, catatonia, um, psychosis, major depressive resistance. Remember, heart, lungs, and brains, right? So all that needs to be in good place in order for one to qualify for ECT. Remember that they need to be able to tolerate anesthesia, and remember the number one complication for ECT that most of the folks remember of. So what adverse effect is commonly associated with electroconvulsive treatment? A, language comprehension difficulties, long-term memory, short-term memories, or inability to learn new information. Yes, so I think we covered this pretty much in details. Guys, in the course, we have those questions. They are there for a reason, okay? So if you have the questions, look at those questions in the PDF as well, because they are important, okay? So these are the highlight of what we covered. So they will be important to you. All right, so that was a short and sweet, just the way we like to do our modules, to the point, not a whole lot of fluff. And let's move on to the next one. So let's see what we got next here. All right, so we covered all this yesterday. So at the end of today's presentation, I'm going to show you the ANCC blueprint. When you look at the blueprint, it really tells you where you should spend the most of your time. Is modules 1, 2, and 3. That's domains 1, 2, and 3. Okay? So now let's talk about suicidality. We covered all these topics yesterday, and now we are on clinical management of suicidality. Well, let's start by saying never pick an answer that says suicidal contract. Because contracts that the patient will not harm themselves does not work. Okay. Now, safety planning, it's always a strong answer. Safety planning. Okay. So, safety planning is a step down process that decreases the likelihood that one would proceed with harmful behaviors, right? Think of it as fire drills. Can you imagine what a confusion would be if you work in a big building and there would be no fire drill? When the smoke comes in, people would not know what to do. So that is akin to safety planning. We get those patients and we teach them, hey, when you are having those suicidal thoughts or intrusive thoughts, what do you do? And we pre-plan so that when it happens, they are better equipped to answer to those disturbing thoughts. So, suicidality. First thing is always, always in real life on a board, it doesn't matter. You have to always take it serious. I like to say that when I work in AD, I can miss anything, right? I can miss almost anything, right? I can miss a GERD. I can miss also, I can miss, you know, maybe even a stomach blockage. I don't want to miss none of this stuff, but I can, right? The patient's not going to die. But what if the clinician misses a stroke or heart attack, right? So this is akin to those patients with suicidality. If you think, oh no, I know this patient, he's not going to do it. Well, it only takes one time for you to be wrong. So you can never be wrong on those as much as possible, obviously, right? So always take it seriously, right? Even if you know the patient very well. So they are genuinely in danger and require assistance. Evaluate the need for hospitalization, engage in available social resources, identify what is causing the distress, and do not rely on safety contract. Okay, safety contract, never. Safety planning, good. Safety contract, no good. So if you do not know what the difference is between safety planning versus safety contract, write that down because you need to look it up. Okay, and we can go over at the end of today's event. Now, there is mnemonics, right? Consider hospitalization. I'll always assume the patient is very serious. Uh, think of a social resource that can be utilized, identifying what's causing the distress, leaving out safety contract always, and engage in the patient with care. Okay, these are easy questions, yet very hard, unless you take a board prep like ours. Because everyone thinks, unless if you take a board prep, that you should pick the answers that says previous suicide attempt. That would be a mistake. Each one of those example here are one risk factor. So what does that mean? When you're comparing patients A, B, C, and D, you have to count how many risk factors for each one of the options. And the latter, the option that has the most risk factors, is the one you pick. So it does not matter if John had the previous suicide attempt and Mary is a 55 years old, divorced, lost her job with major depressive disorder. Mary would be the most at risk, not John with the one previous suicide attempt. Okay, so it can be tricky, and you need to do some questions on this because it can be very tricky. So what are the things we need to look out? Well, last week or the week before, someone emailed me and says, Dr. Lopez, I'm not good at acronym. You do not need to be good at acronyms, right? These are common risk factors. Male, 45 and older. Females, 55 and older. DSS, divorced, single, and separated, right? That is a risk factor. If they have substance use, that's another risk factor. If they have a psychiatric condition, that is another risk factor. Living alone, that belongs to the DSS, divorced, single, and separated, right? Recently, lose of a status, whether they occupy the very important um, position. Like I work with a lot of high profiles individuals, right? Retiring as they leave in their position, but they are high profiles. And sometimes they really feel it transitioning from this high profile to a normal civilian without losing the status, right? Race, white, Caucasian, older are at risk, and we mentioned 45 for males and 55 for females, and physical illness, right? And then you start thinking about this, and don't forget a family history of suicidality, right? Previous, not suicidality, but a suicide in the family. Okay, so you don't need to memorize med sprawls. These are common sense. At least I would assume so. Okay. So, example, when the patient exhibits multiple risk factors such as being divorced, having history of substance abuse, always count the risk factors to determine which options A, B, C, and D has the most risk factors. Okay, so a 29 years old female arrives at the emergency room following a suicide attempt by cutting her wrist. A psychiatric mental health nurse practitioner, as a psychiatric mental health nurse practitioner, which of the following would be your priority? Assess her coping skills. Assess the current level of suicidality. Take her vital signs. And assess her health history, right? So this one, I think you guys are, we got some B's, Okay, I love it. We got some B's. Who else take his B's? B, then C. Nas mentioned there. All right, Linda said B, right? Love it, B. Okay, so you guys have said B. Let me ask you a question. A 29 years old. Okay, let's start from at the end. What did I say when the question says priority, initial actions? What are the 3 steps you should do? Step 1, airway, breathing, circulation. It says priority here. What should be the priority? What should be the initial action? Step 2, Maslow hierarchy of needs, the pyramid. They need food, shelter, air, security, and then the nursing process, right? So does it matter that she is suicidal? Let's say she's highly suicidal, super suicidal, cannot leave her alone for 1 second. Let's say that is the extreme case. Does it matter if she is highly suicidal, but she's bleeding to death, right? Which one takes precedence here? So the scenario says she had in a suicide emergency room following a suicide attempt by cutting her wrist. At this moment, I care about saving her life, medical conditions before psychiatric conditions, right? So you need to take the vitals because the vitals is airway, breathing, circulation, right? So hopefully this sinks in not only for the question, but for the prompt when it says priority, prioritizations, initial action, airway, breathing, circulation, muzzle, and then the nursing process. We didn't talk about the nursing process. The nursing process will be assessment. Now, the assessment would be different than what we know as an assessment for the RN. The assessment would be collections of data, literature, research, labs, or even vital signs in the sense of collecting numbers so you can make a diagnosis so that you can make a intervention. Okay, so great questions. So that way we kind of get the structure. If you learn the structure of the task, you get all the questions right, every single one of them. Okay, so take her vital signs. That's the immediate priority in this situation. It's a critical situation, right? So that is the immediate priority. Sure, before she leaves, we need to have a safety planning. She may not even be leaving, right? She might be going to an inpatient, most likely. All right, so let's move on. Let me stop this. We're going to talk about bipolar disorder. Ooh, that's a good one. Lots of questions on bipolar. So let's